Hello, welcome to Introduction to PCS Coding, Ancillary New Technology Procedures. And this is Introduction to PCS Coding Part 3. I'm Mrs. J, Curriculum Director at AMCI, and for this presentation, our learning objectives are, we only have one, and that is to provide instruction on PCS coding. Also, we're going to talk about coding for the ancillary procedures and new technology procedures, as well as provide practice scenarios. All right, coders, are you ready to get started? So let's do it. All right, previously in part 1, we said that the recommended text to study PCS is Optum 360. And specifically, if you're testing or preparing to test for the CCS exam, this is the recommendation, AMCI recommendation, because of the indicators that are in the book. We're not going to talk about indicators because that's a little more advanced and it is not introduction to PCS, but we think we should tell you this because if you're purchasing a book, you want to make the correct purchase from the beginning rather than later. Also, used in this lecture, we're using the AMA version of ICD-10-PCS. It's important that you know that because you will have some differences in your books, specifically your appendices. They'll be different. All right. So now that we've gotten that out of the way, let's discuss the ancillary sections. But before we do that, let's review what we've already discussed. Okay, so we're discussing the PCS code, specifically that first character sections. We're going section by section. And in part 1, we covered the medical and surgical section, and that value is 0. In part 2, we discussed the medical surgical related section, and that first character value will be either 1, 2, 3, 4, 5, 6, 7, 8, 9. And today, we're going to talk about the ancillary section. That's values B through H, and we're going to talk about new technology, and that's value X. Now, let's begin our discussion on the ancillary section. And before we move any further, I want to draw your attention to a note. Previously in parts 1 and 2, specifically for the medical surgical section and the medical surgical related section, we were referring to that third character space as root operations. But in this section, in the ancillary section, the third character space will be referred to as root types. All right? So thought I would get that out of the way. Now let's get started with our first procedure, or not procedure, our first section, which is imaging, and that will be B. So let's take a look at the PCS code for imaging procedures or root types, or you know what I'm saying. All right, so we know that the first character shall be a B. The second, you have your body system. The third, as I've said, is going to be your root type. Fourth, your body part. Fifth, contrast. 6 qualifier, 7 qualifier. Well, you know what this is telling me on site? That this is going to be a highly specific code. You got 2 qualifiers here. All right, so let's take a look at our character meanings page. We know we are on the correct page because this is section B. Now, when you are coding for imaging procedures, examples of imaging procedures are your standard X-rays, MRIs, CT scans, and ultrasounds. So let's take a look at this character meanings page to really look at how the code is set up. And even the character meanings page is a little different, because if you look here, you've got your second character descriptor right here, your descriptors right here. And previously they were not. We started with our root operations. So we've got our body systems in this first column. And for imaging, we have body systems from nervous system, heart, upper arteries, lower arteries, your veins, your lymphatic system, eye, ear, nose, mouth, and throat, respiratory system, gastrointestinal system, hepatobiliary system, and pancreas, endocrine system, skin, subcutaneous tissue, and breasts, connective tissue, skull and facial bones, non-axial upper bones, lower bones, axial skeleton, except skull and facial bones, urinary system, female reproductive system, male reproductive system, anatomical regions, fetus, and obstetrical. Then your root type, you've got 5. Plain old radiography. You've got fluoroscopy, CT scans, MRI, ultrasounds. And then your body parts, we'll take a look at it. It's on the next page. And then you've got your contrast. Contrast can be defined as high osmolar, low osmolar, other contrast, or none. And then you can even have a qualifier that goes even further. You've got unenhanced and enhanced. We know it as with or without, with and without contrast. You've got laser, intravascular, optical coherence, and none. And then finally, you've got intraoperative, densitometry, sorry about that, intravascular, transesophageal, guidance, and none. Now let's continue on to the next page so we can look at our body parts, and there are a plethora of body parts. These are pretty much the ones that we've discussed in our body systems. The body parts and body systems are very similar. However, the body part is more specific. So if you see the central nervous system, you have the body part will be more explicit. It'll explain it more. All right, so you got your body system, body part, body system, body part. And it continues. You've got your urinary system and your body parts. All right, so that's pretty straightforward. Now let's take a look at our root types. We've got CT scan. And if you didn't know, the actual name for CT is computerized tomography. So that is computer reformatted digital display of multi-planar images developed from the capture of multiple exposures of external ionizing radiation. Yeah, that's what that is. And then you've got your fluoroscopy, and that's a single plane or biplane real-time display of an image developed from the capture of external ionizing radiation on a fluorescent screen. The image may also be stored by either digital or analog means. You've got your MRI. This is computer reformatted digital display of multiplanar images developed from the capture of radio frequency signals emitted by nuclei in a body site excited within a magnetic field. And then you've got your plain radiography, and that is a traditional X-ray. So the formal language or definition or objective of this root type. Oh, we just gone a little too fast, so we're going to go back. This is the planar display of an image developed from the capture of external ionizing radiation on photographic or photoconductive plate. And then finally, you have your ultrasonography. And this is real-time display of images of anatomy or flow information developed from the capture of reflected and attenuated high-frequency sound waves. All right, coders, now that we've learned about our 5 key root types for imaging. Let's demonstrate our knowledge of Section B with these next exercises. All right, so our documentation says that we have a non-contrast CT of the abdomen and pelvis. All right, coders, we have to determine what the root type is. So let me give you a little help. You know those 5 root types that I've just described? Here they are. Take a look. In your task, what is the root type? And also, I want to remind you, if you want to solve it, go ahead and pause the presentation, and we're going to continue. The root type for non-contrast CT of abdomen and pelvis is computerized tomography or CT scan. So what we're going to do next, we're going to look up computerized tomography CT scan in our index. Then we're going to scroll down and we're going to look for abdomen and pelvis, and it's going to give us the code BW21. Now, we're going to have to find the corresponding table. And there it is, BW2. This is imaging of anatomical regions, computerized tomography, and look at that definition, computerized reformatted digital display of multi-planar images developed from the capture of multiple exposures of external ionizing radiation. All right, our 4th character, well, in the index, they say it's 1, so let's go ahead and verify it. And if we look down, boom, it is 1. I like this, but I see a problem. If we go to the next character, we've got high osmolar, low osmolar, and other contrast, and this says no contrast, our documentation. Oh, you know what? Let's look down to the next row and see if we see our body part. I do. There's abdomen and pelvis, and then next to it, guess what? No contrast, no qualifier, and no qualifier. So our final code, BW21ZZZ. All right, coders, how did you do? If you got it correct, outstanding. But if you learned something, you know what, coders? That's even better because it's priceless. All right, let's move on. We have another exercise, and this is intravascular ultrasound, left subclavian artery. All right, coders, you know what you have to do. What is the root type? If you said ultrasonography, outstanding. So we're going to go to the index, look up ultrasonography, then we're going to scroll down. What are we looking for? Subclavian artery? Yes, artery. And then go down further, subclavian, left, intravascular. You know what? It gave us the full code. B342ZZ3. And coders, again, you cannot code from the index, but you can code directly from the table. So let's go ahead and verify that table, the B34 table. Imaging, upper arteries, ultrasonography, and since I'm learning how to, I'm learning PCS, or we're learning PCS, I'm not learning it, but we're learning PCS. Let's always read these objectives or definitions just so we can make ourselves familiar. Real-time display of images of anatomy or flow information developed from the capture of reflected and attenuated high-frequency sound waves. Sounds like it to me, ultrasound. Okay. The 4th character body part, our documentation says it's 2, so let's go ahead. I agree, it is 2. Our 5th character shall be Z, 6th Z, and our 7th character, if you said 3, that is correct. We do have an intravascular ultrasound. So our code, B3427, ZZ3. 3. All right, coders, if you got that correct, well done. All right, it's time to move on to the next section. C, this is nuclear medicine. All right, so let's take a look at a nuclear medicine PCS code and let's see if there are any differences. Well, we see the section is C, the body system. We've got the root type. This root type, we know we've already discussed that this third character shall be root type for these ancillary procedures. And fourth is body part. 5 is radionuclide. So they're going to be getting really specific in terms of what is being administered. And then 6th will be your qualifier, and so will 7. All right, so now we're at the character meanings page. We know we're at the correct page because the section C is on the page. And let's go ahead and define what nuclear medicine is. It's a specialty that uses radioactive tracers or radiopharmaceuticals to assess bodily functions and diagnose and treat disease, specifically designed cameras that allow doctors to track the path of these radioactive tracers. So an example will be a PET scan. All right, so let's take a look at these character meanings. We see the first column describes character 2, that's the body system, and the body system is very similar to section B for imaging, and your third character will be your root type. You've got planar nuclear medicine imaging, tomographic or tomonuclear medicine imaging. You have position emission tomographic or PET imaging, a PET scan I was just talking to you about. You have non-imaging nuclear medicine uptake, non-imaging nuclear medicine probe, non-imaging nuclear medicine assay, and systemic nuclear medicine therapy. Your body part character, we're going to take a look at those, but your fourth character corresponds with your second. I'll show you that in a moment. Then you've got your radionuclide, your fifth characters. You have technetium, I know I'm saying that wrong, but technetium, that radionuclide. If you're using cobalt 58, samarium 153, krypton, yeah. Carbon, cobalt, indium, iodine 123, 131, 125, fluorine 18, gallium 67, oxygen, phosphorus, strontium, rubidium, nitrogen, thallium, xenon 127, 133, chromium, other radionuclide, and none. And then your sixth and seventh characters shall be none. All right, coders, let's take a look at the body parts. As you can see, they correspond to the second character. If the second character is the nervous system, the body part will be either the brain, cerebrospinal fluid, central nervous system. Then you've got your heart, right and left, myocardium and heart, and veins and lymphatic system, and so on. All right, now that we've looked at the character meanings, let's take a closer look at the root types. We've got non-imaging nuclear medicine assay, and this is introduction of radioactive materials into the body for the study of body fluids, blood, elements by the detection of radioactive emissions. Then you've got nuclear medicine probe, non-imaging, and this is introduction of radioactive materials into the body for the study of distribution and fate of certain substances by the detection of radioactive emissions, or alternatively, measurement of absorption of radioactive emissions from an external source. And then you have non-imaging nuclear medicine uptake. This is introduction of radioactive materials into the body for measurements, keyword, of organ function from the detection of radioactive emissions. And you've got planar nuclear medicine imaging. This is the introduction of radioactive materials into the body for single plane display of images developed from the capture of radioactive emissions. And then you've got your positron emission tomographic or PET imaging. This is introduction of radioactive materials into the body for three-dimensional displays of images developed from simultaneous capture, 180 degrees apart, of radioactive emissions. I'm just going a little too fast and hitting that button just a little too hard. Sorry about that. And then you've got systemic nuclear medicine therapy. This is introduction of unsealed radioactive materials into the body for treatment. You've got tomographic or tomo nuclear medicine imaging, and this is, okay, just one more thing, okay? And this is introduction of radioactive materials into the body for three-dimensional display of images developed from the capture of radioactive emissions. And coders, the reason why I'm reading these is because if you select any one of these values, it has to meet the complete definition, the full gamut of that definition, not part of it. So it's good to just kind of read through it. Sometimes we skim, as you can see, I've been trying to skim too, but it is important that you read it and you know what it says. Now that we've learned the key root types for nuclear medicine, Section C, let's demonstrate our knowledge of Section C with these next exercises. You ready? All right. All right, so we've got a tomo scan of right and left heart, unspecified radiopharmaceutical qualitative gates rest. Sorry. All right, tomo scan of right and left heart, unspecified radiopharmaceutical qualitative gates rest. All right, coders, what is the root type? I'm going to give you a second or two, but if you want to pause, go right ahead. And your root type shall be, and it's really about looking at those keywords, and the keywords draw us to tomographic, tomo, nuclear medicine imaging, right? Yeah, it's not a PET scan, but this looks about right. So we're going to look up that key or that root type. And if you didn't know, you might go to nuclear medicine, but if you looked there, it would tell you to see tomographic tomonuclear medicine, and that's what we're going to do. Tomographic nuclear medicine of what? The heart. Down below here, right and left, it gives us code C226. Let's go find that corresponding table. C22, this is nuclear medicine of the heart. Tomographic nuclear medicine imaging, the definition is introduction of radioactive materials into the body for three-dimensional display of images developed from the capture of radioactive emissions. And our code says the fourth character is a 6. And you know what, coders? That's what it is, right and left heart. Now, we have to figure out what the fifth character is. Is it technetium or other radionuclide? Well, it doesn't, their documentation doesn't mention technetium, and so I guess it's going to be other radionuclide. And our qualifier will be Z for none, and the seventh qualifier will be Z for none, and our final code will be C226YZZ. All right, coders, how did you do? If you got it correct, outstanding. But if you learned something, coders, that's priceless. All right, we've got another exercise. technetium. I know I'm saying it wrong. I'm going to still say technetium. Technetium. Penetrate assay of kidneys, ureters, and bladder. All right, coders, look to your right and tell me, what is the root type? I'll give you a moment. And if you said non-imaging nuclear medicine assay, keyword is your assay. All right, so we're going to look up non-imaging nuclear medicine assay. And if we go look up nuclear medicine, it'll direct us to look up non-imaging nuclear medicine assay of what? Of the kidneys, ureters, and bladders. It gives us default code CT63. It's time to look for that corresponding table. CT6, this is nuclear medicine, urinary system. Yeah, non-imaging nuclear medicine assay definition, introduction of radioactive materials into the body for the study of body fluids and blood elements by the detection of radioactive emissions. That sounds about right. Our code says that our fourth character is a 3, and I agree. Cub, K-U-B. Kidneys, ureters, bladder, our radionuclide. Well, it says that we have this technetium, and I agree. Let's go ahead and select it. And our sixth character shall be none, 7 shall be none, and our code shall be CT631ZZ. All right, coders, how are you doing? Go ahead and talk to me. I can hear you. Okay, I can't hear you. I can feel you. All right, I know you're getting this. I do. All right, let's move on to section D, radiation therapy. All right, so let's take a look at the radiation therapy code. We've got our section, the body system, of course, the root type. We've got body part, modality modifier, isotope, and qualifier. All right, so let's look at these character meanings, and let's go to the character meanings page and figure out what these characters mean. All right, we know we're on the correct page because we're at section D, radiation therapy. And what is radiation therapy? We know radiation therapy are therapies used for cancer treatment. And some examples are external beam radiation to the abdomen. There you go. Now let's take a look at our body systems, pretty much similar to C and B, but we've got central and peripheral nervous systems, lymphatic and hematologic system, eye, ear, nose, mouth, and throat, respiratory, gastrointestinal, hepatobiliary system, and pancreas. You've got endocrine, skin, breast, musculoskeletal system, urinary, female reproductive system, male reproductive, anatomical regions systems, and then your modalities. This is your third character, your beam radiation, your brachytherapy, your stereotactic radiation or other therapy. Now, I did call this a root type, but you can also refer to it as a modality. And then your treatment site, you'll see it on the next page. We've got more modality qualifiers. This is photons, less than 1, photons between 1 and 10 MeV, photons greater than 10 MeV, electrons, heavy particles like protons and ions, neutrons, neutron capture, contact radiation, hyperthermia, high dose rate, low dose rate, intraoperative radiation therapy, stereotactic, other photon radiosurgery, plaque radiation, isotope administration, stereotactic particulate radiosurgery, stereotactic gamma beam radiation surgery, laser interstitial thermal surgery. And then you have your cesium, iridium, iodine, palladium, californium, iodine, phosphorus, strontium, other isotope, none. And your seventh character shall be intraoperative or none. Now let's take a look at these treatment sites. Oh, looks like the body, the treatment site is like the body part, and it corresponds to character 2, the body system. All right. So now let's turn our attention to those root types or those modalities. Let's take a look. We've got beam radiation. And this is radiation therapy that uses X-rays or gamma rays that come from a special machine called a linear accelerator. Brachytherapy. This is radiation via insertion of radioactive implants directly into the tissue. And stereotactic therapy, this is a type of external radiation therapy that uses special equipment to position the patient and precisely deliver radiation to a tumor. The total dose of the radiation is divided into several smaller doses given over several days. And finally, other radiation. This is where all other radiation treatments will be found. All right, coders, now that we've learned the key root types or modalities for section D, let's demonstrate our knowledge with these next exercises. All right, plaque radiation of the left eye. On the right, I have my modality or root type chart. Go ahead and tell me what the root type is. I'll give you a moment. And if you said that the root type for plaque radiation of the left eye is other radiation, outstanding. There's no mention of the others, so we have to assume that it's other radiation. It's not beam, it's not brachytherapy, it's not stereotactic, so it's other. So when you have something generic like that, how you look it up in the index is 9 times out of 10 will be either you're going to look it up under other radiation or you're going to look it up under the exact type of radiation. In this case, plaque radiation is found in your index. So we're going to look up plaque radiation followed by the location on the body, which is your eye. And it gives you the full code, D8Y0FZZ. And coders, we do not stop here. We have to go verify that at the table, the corresponding table. Let's go to the D8Y table. Radiation therapy, I, other radiation. You see there's no definition, nothing, no objective, because this is so general. And our code tells us that our fourth character type or treatment site will be the eye. That's the only option that we have. The modality qualifier, character 5, will be plaque radiation. Yes, our isotope, there's none, and our qualifier, none. So coders, our final code will be D8Y0FZZ. All right, are you ready for another exercise, coders? Let's go. All right, so 8 MeV, photon beam radiation to the brain, coders. What is the root type of the 4? What's your selection? If you say beam radiation, outstanding. So we're going to go look up our modality in the index under beam radiation, our body part, brain, and it gives us the default code D000. Now we have to locate the corresponding table, D00, and remember these tables are in alphanumeric order according to the section in the PCS manual. So D00, radiation therapy, central and peripheral nervous system, beam radiation, and let's go down and look for our fourth character. Our code tells us that it's 0 in our fourth character in the index is correct because we did have a brain. We had radiation to the brain, and this is the correct row because we see our photons, 1 through 10, MeV, we have 8, it falls right there. Our isotopes, none. Our qualifier, none. And our code, D0001ZZ. How are you, coders? Did you get that correct? You know what? I'm pretty confident. I think you did. I'm pretty sure you did. All right, it's time to move on to value F. Now, section F is the section for physical rehabilitation and diagnostic audiologists. So it's pretty much rehabilitation and diagnostic hearing test. Okay? So there are a lot of elements under this. So let's go ahead and break this down. We've got the code. Of course, the section is F. Our root type will be 3. The third character, our fourth character is body system and region. We've got a type qualifier at character 5. Our character 6 is equipment, and everything else is the same. Okay, this really does. It is a different structured code. So let's go ahead and let's look at the character meanings page to see at a glance what this code, what the codes and the sections mean. All right, so we've got section F. We're on the correct page. And remember, we are coding for 2 things, physical rehabilitation and diagnostic audiology. Your second character will pertain to your section qualifier, which is either rehabilitation or diagnostic audiology. It'll be 0 for rehabilitation and 1 for diagnostic audiology. And you're going to see physical rehabilitation encounters like therapies, rehabilitation assessments, speech therapy, all kind of stuff. Okay, so an example could be hydrotherapy, treatment for an elbow ulcer. Now for diagnostic audiology encounters, you could have, example would be a hearing assessment. All right, so let's first look at the character meanings page for rehabilitation. Your root type, character 3, will be speech assessment, motor and nerve function assessment, activities of daily living assessment, speech treatment, motor treatment, activities of daily living treatment, hearing treatment, cochlear implant treatment, vestibular treatment, device fitting, caregiver training, all fall under this section qualifier. No, this is the root type. And then you've got your body system or region, and it's, you know, pretty self-explanatory. And then you've got your qualifier character, and this is on the next page. So there are tons of them. And then we've got our equipment. You can see audiometer, sound field booth, electrocaustic emittance, acoustic reflex, hearing aid section, electrophysiologic, and I want to go back to hearing aid selection fitting test. Keep in mind, this is rehabilitation, and the diagnostic audiology is just pretty much diagnosing the hearing condition. And the hearing condition could often be treated over in the physical rehabilitation section. So keep that in mind. You have vestibular balance, cochlear implant, physical agents, mechanical, electrotherapeutic, orthosis, assistive, adaptive, supportive or protective, aerobic endurance and conditioning, mechanical or electromechanical, and your 7th qualifier, none. All right, coders, let's just skim the qualifier type, character 5, it's long, and pretty much the qualifier type corresponds with the third character. All right. So it's going to fifth character corresponds to the third character. All right. So if speech assessment is your third character, they have about 20 some odd options. The type of speech assessment, is it filtered? Is it speech threshold, speech word recognition, etc.? All right, let's continue. And these are for your rehabilitation. And let's just look at the root types. We're not going to go over them, but just so you know, I got a lot of this material from the PCS manual. All right, so in the index, you can pull it up yourself too if you want to read them at a glance. All right, coders, now we're at the diagnostic audiology, not as extensive. Nonetheless, it's still section F. And diagnostic, the second character, your selection section qualifier will be 1. Your third character or root type will be your hearing assessment, hearing aid assessment, vestibular assessment. So these are pretty much hearing tests. And you've got your fourth character, your system or body region will be none. Your type or your qualifier, we'll take a look in a moment. And then you've got your equipment that you'll use. Character 6, occupational hearing, audiometer, sound field booth, tympanometer, electroacoustic emittance, acoustic reflex, hearing aid selection fitting test, autoacoustic emissions, electrophysiologic, vestibular balance, cochlear implant, audio visual, assistive listening, computer, other equipment, other. And then your seventh character shall be 7. Now let's take a look at your fifth character, the type or the qualifier. And you'll see your fifth character corresponds to the third character. All right, so the type of test will be at your third character, and the qualifier will further specify that hearing test. And then your hearing aid assessment, your fifth character qualifier will further specify what type of hearing aid assessment it was. And your vestibular assessment, your fifth character qualifier, will further specify your vestibular assessment. And coders, now that we've learned all about, the key root types for rehabilitation and diagnostic audiology, let's demonstrate our knowledge of section F with these next exercises. All right, coders, we've got a Bekesy assessment using audiometer. All right, coders. So I think I made the point that the first character will be an F, and I said that in the rehabilitation in section F, rehabilitation second character will be 0, diagnostic audiology will be 1. So we know that the first two characters based upon what I've just said shall be F and 1. We just know that. All right, coders, what is your root type? And if you didn't know, it will be assessment. Yeah. And it even tells you, if you go to assessment, it'll say, go see hearing assessment, diagnostic audiology. So we're going to go do that. There it is, hearing assessment. Wait a minute, hearing assessment. What's the difference between F14Z, F13Z? Well, there's nothing under F14Z, and we see, if we look down further, we see F13Z and F1Z3, Z Bekesy or Bekesy audiometer. None. Oh, no, we're going to go back to this. None. All right, coders. So you might say, all right, Mrs. J, you didn't explain that. I know I didn't. Okay, coders. Sometimes you have to just look at them both. So if you go to the hearing assessment table F14Z, you will see that you don't, it's that F13Z is more specific. Specifically, that fifth character, that Bekesy audiometer, and the sixth character audiometer really was specific. So this is the better of the two. So I'm sorry if I did that to you, because I did look ahead and I didn't see it. So I want to encourage you to do it. If you don't see your keywords or your key terms, then you have to move on and you got to take the next option. So let's, our final code will be F13Z31Z. Sorry about that, coders. All right, let's shake that off and let's move on. I just didn't do a good job with this. All right, so we got a little ahead of ourselves. Coders, what is the root type? If you said fitting because you saw it on the screen, outstanding. So if we go to fitting and we scroll down and we see ocular prosthesis, it takes us to the exact code F0DZ8UZ. And let's go find that corresponding table, F0D. Physical rehabilitation and diagnostic audiology rehabilitation, device fitting. The definition is fitting of a device designed to facilitate or support achievement of a higher level of function. All right, I think that's about right. Now, our fourth character, body system region, shall be Z for none. That's all we have. Our fifth character will be prosthesis. That's in our documentation. Our sixth character, prosthesis as well, U. And our final character will be Z. And our final code, F0DZ8UZ. Encoders, if you got that correct, I am proud of you. Outstanding. All right, now it's time to move on. We are moving on to section G and we're getting close, coders. All right, section G is for mental health. All right, let's take a look at a mental health PCS code. We know that first character section, G, followed by your body system, the root type. You've got your fourth character qualifier type. Your fifth will be a qualifier, sixth qualifier, seven qualifier. Wow, so we've got 3 qualifiers here. Let's take a look at the character meanings page. We know we're on the correct character meanings page because the first character is a G. And if we define mental health treatment, that's what it is. An example is electroconvulsive therapy. Now let's take a look at our characters. Z will be our body system, which is none. Then we move on to character type, will be 3, or our root type. You've got psychological tests, crisis intervention, medication management, individual psychotherapy, counseling, family psychotherapy, electroconvulsive therapy, biofeedback, hypnosis, narcosynthesis, group therapy, light therapy. And then your fourth character, your qualifier, will be, they correspond to your root type. And you've got, I'm not going to read all these. You're not going to remember it, but they do correspond to your root type. And then your fifth character, none, 6, none, and 7, none. So this is pretty straightforward. So let's take a look at our root types. are common root types. I'm not going to read all of these for you because you know the majority of them. You know, if you're a coder, biofeedback, you know what counseling is, crisis intervention, electroconvulsive therapy, family psychotherapy, group psychotherapy, hypnosis, individual psychotherapy, light therapy, medication management, narco synthesis, and I think light therapy too. We just didn't have enough room. All right, so now that we know the root types for mental health section G, let's go ahead and let's practice our knowledge. All right, so our scenario or exercise says cognitive behavioral therapy, psychotherapy, individual. All right, sorry about that, coders. What is the root type? If you said psychotherapy, outstanding. So we're going to go to the alphabetic index. We're going to look up psychotherapy. And you know what? It's divided. You've got family psychotherapy, you've got group psychotherapy, but our documentation specifically says individual. And it tells you psychotherapy, individual, mental health services. It tells you to see that. So we're going to look down. We've got mental health right here. And let's look cognitive behavioral. That's exactly what our documentation says. It takes us to code GZ58ZZZ. Let's go find that corresponding table. GZ5, mental health. None, individual therapy. Now, individual therapy is treatment of an individual with a mental health disorder by behavioral, cognitive, psychoanalytic, psychodynamic, or psychophysiological means to improve functioning or well-being. All right, so our code tells us that our fourth character is cognitive behavioral. I agree. So we'll say it's 8. Our fifth character will be Z, sixth will be Z, and seventh will be Z. Our final code, GZ58ZZZ. A lot of Z's, a lot of sleep. All right, coders, how are you coming along? We're almost there, and I know you're doing well. So let's do another one. Narcosynthesis. What is our root type? Well, we only have one word there, so let's go and let's look it up. I'm all out of sorts here. Wow, sorry about that. Go on and play yourself out. Okay, here it is. So if you look up narcosynthesis, GZGZZZ, that's what it is. You find the corresponding table, GZG, mental health, none, narcosynthesis. And narcosynthesis is the administration of intravenous barbiturates in order to release suppressed or repressed thoughts. So that's how they do it. And then your fourth, fifth, sixth, and seventh characters shall be Z's, G, Z, G, Z, Z, Z. All right, coders, if you got that correct, outstanding. All right, so we are going to go to our very last section, which is section F, very similar to section G. And this section is substance abuse treatment. Don't confuse the two, okay? Because they are not the same. Mental health and substance abuse treatment are not the same. They are not coded the same. They're very similar. So the section will be H, body system is your second character. Your third character is root type. Your fourth is qualified, type qualifier. Your fifth is qualifier, sixth is qualifier, seventh qualifier. So you got a lot of qualifiers. So I got a feeling the G has all the Z's, the H's will too. All right, so we're on the correct page. Our section H matches our character meanings table page. So what is substance abuse? This is treatment for abuse of substances. Yeah. So example will be drug detoxification. Let's take a look at our characters. Our third character will describe the type, and the types of treatment will be detoxification, individual counseling, group counseling, individual psychotherapy, family counseling, medication management, and pharmacotherapy. And your type, your root type, will correspond to the qualifier, the fourth character qualifier. So I'm not going to read all of these, but let me just read individual counseling. Some of the fourth character qualifiers will be cognitive therapy or counseling, behavioral counseling, cognitive behavioral, 12-step, interpersonal, vocational, psychoeducation, motivational enhancement, confrontational, continuing care, spiritual, pre and post test infectious disease. And then your fifth, sixth, and seventh characters are none. Now let's look at the root type of these for Section 8. And I've just read them, but you've got detox services, family counseling, group counseling, individual counseling, individual psychotherapy, medication management, and pharmacotherapy. Now, coders, now that we've learned about the key root types for substance abuse treatment, Section H, let's go ahead and demonstrate our knowledge of Section 8 with these exercises. All right, now Trexon, treatment for drug dependence. All right, coders, do you know what the root type is? All right, I'll give you a little hint. I'm going to put my little chart up here. Root type. Okay, so take a second to look at the chart and tell me what is the root type. If you said pharmacotherapy, outstanding. Yes, because pharmacotherapy is treatment with the use of drugs. Now we know our drug is naltrexone. So let's go ahead and look up pharmacotherapy for substance abuse. And if you scroll down, you will find naltrexone. And it gives you the code HZ94ZZZ. Let's go find that corresponding table. HZ9 is substance abuse treatment, none pharmacotherapy, and the definition is the use of replacement medications for the treatment of addiction. All right, coders, let's find our fourth character, the character documented in the index. Fourth character will be 4. Boom, it is correct. Now Trexon, your fifth character, Z, sixth, Z, seventh, Z, and your code HZ94ZZZ. Coders, how are you? Are you ready for another exercise? Well, I know you are, and I just want to tell you, if you got that correct, outstanding. But if you learned something, coders always know that's priceless. All right, so we're embarking upon our final exercise. This is substance abuse treatment, family counseling. What is the root type? If you said family counseling, value 6, outstanding. So that's what we're going to look up in our index. In fact, we're going to look up counseling, and then you've got a little section for family right up underneath for family, for abuse, substance abuse, other family counseling. There you go. HZ6 3ZZZ. Whew. The corresponding table, HZ6, substance abuse treatment, none, family counseling, and then it's got some definitions here. The application of physiological methods that includes one or more family members to treat an individual with addictive behavior. And then they give you an explanation here. Provide support and education for family members of addicted individuals. Family member participation is seen as a critical area of substance abuse treatment. Our fourth character will be other family counseling. Fifth, none. Sixth, none. Seven shall be none. And the final code, HZ63ZZZ. All right, coders, how do you feel? Are you ready? Are you ready for the final section? And this is new technology. I am. I'm excited. New technology, section X. Let's take a look at the PCS code for a new technology procedure. We know that first character will be an X. Then it's followed by body system. And then look, coders, we're back to root operations. We've got body part, approach, and sixth and seventh characters are different. Sixth character will be device, substance, or technology, and your seventh character, this is new technology group. Now let's go and take a look at the new technology section. Well, first, it doesn't really have the character meanings page. Well, in my book, in my ICD-10-PCS manual, AMA version, we don't have it, but we do have a lot of guidelines. And this is new technology. The first character will be X. It's got second character 2 all the way through Y. So there's a lot of room for expansion, a lot of new technology coming on board. And you got a lot of guidelines, the AHA Coding Clinic. So check those out. And now let's take a look at the actual new technology table. So we know we're at the correct table because you see the section X, and we've got new technology cardiovascular system. Now let's take a look at, and these are divided into groups. So this will be group 1, and this is new technology group 1, and you've got group 2 and so forth. But I just want to draw your attention to the XH table. This is skin and subcutaneous tissue, fascia, and breasts. And then you've got muscles, tendons, bursae, and ligaments. That's K. You've got bones. You've got, it's really, really developing. And we really don't have very many exercises, but let's take a look at a chart for new technology joints. And that second character is R. All right. So in this case, we've got new technology joints monitoring, and down below it, you've got new technology joints fusion. And let's just look at how they are expanding. You've got new technology when fusing the cervical vertebral joints 2 or more. And then this seventh character qualifier will tell you the type of new technology group it falls under, and that will just be in your documentation. So it's nothing for you to figure out. It'll be in your documentation. So I just don't want to go too deep, but here's what a new technology scenario will look like. Open aortic valve surgery, zooplastic tissue, rapid deployment technique. What do you think the new technology is? All right, the new technology will be zooplastic tissue, rapid deployment technique. And you know what, coders? These are going to be straightforward. You are going to just look up that new technology procedure. It'll, to the letter, you see it. Zooplastic technique, tissue. Why am I saying? Rapid deployment technique, replacement, takes you to the table. X2RF, let's go. X2R, this is new technology, cardiovascular system replacement. Definition is putting in or on biological or synthetic synthetic material that physically takes over or takes the place and or function of all or a portion of a body part. Okay. Fourth character shall be aortic valve as represented in our documentation, aortic valve. And then our fifth character, well, it's either open approach, percutaneous, or percutaneous endoscopic. Our documentation leads us to open, so that's what we're going to choose. We only have one option for sixth character, device, substance, or technology, and that's zooplastic. And we only have one option for qualifier 7, new technology group 2. All right, coders, if you said the answer was X2RF032, outstanding, outstanding. All right, coders, this concludes the presentation for PCS Coding Part 3, Ancillary and New Technology. I do want to show you, if you need more practice, what you can do. I would get the ICD-10-CM and PCS Coding Handbook. There are a plethora of examples and exercises and practice. Get the version with the answers because, you need to know if you're right or wrong. And finally, in your ICD-10-PCS, just in your book, I know the AMA version, the Optum version, and most versions, even AAPC version, they have additional coding, lots of coding exercise or lots of coding practice. In this version, AMA, it's in Appendix K. And coders, if I didn't tell you anything, your appendices will be your friend. Yes, they have done, I believe PCS has done a tremendous job giving you help on ways to learn PCS. Fabulous, fabulous job. And you know what, coders? You have done a fabulous job too. And this completes our instruction on PCS coding for ancillary, new technology, and procedures. And this completes the presentation on Introduction to PCS Coding.
Thank you for watching an AMCI exclusive presentation in partnership with AAPC. Until next time.